Hi, welcome back to Ahead of the Curve. I'm your host, Dr. Megan Teed, and today I have a special guest with me, my friend and my mentor, Anna Hartman, also known as the MovementREV. Welcome, Anna.
Hello, thank you for having me. So stoked to be on your podcast.
I'm pumped to have you here. I'm a little nervous because I don't know, I always get nervous when I'm interviewing people I really admire. And I've loved learning from you. I actually got to know you or like learned about you through Shantae Cofield on
Mhm.
Instagram. She was talking about how she was trusting you to treat her
Mhm.
knee. And I started following you, and I've since taken a bunch of your courses and just eat up everything that you teach. I love it. So excited to have you on, talk,
Yeah.
pick your brain.
Yeah, I'm happy to be here. Many people find me through Shantae, so I'm very very grateful for that. And I always appreciate her being a raving fan of mine. So I love
Yeah.
that you found me that way. And yes, I love that you've taken all the courses and done all the things and yeah, so many times. Obviously, it's like designed to do that, right? Like one thing leads to the next. But also it's really the internet is wild in that it's really cool to find people, practitioners like yourself, that is just like a perfect fit for what I am sharing. And so yeah, I'm endlessly grateful for that medium to connect with people because it would be
Yeah.
so much harder without the internet. 100%.
Yeah. I don't know how we did it before.
Me neither.
So, Anna, can you tell us a little bit about yourself, your background, and how you are where you are today?
Yeah, that's always like a loaded question, right? Because like the more years that go by, the more I'm like, the story gets longer and longer. I have been in the profession of athletic training. I'm an athletic trainer for 22 years now. So it's crazy that it's been that long. But yeah, so I've always been like a non-traditional athletic trainer in terms of like I've never really been in the team setting, caring for people on the sidelines during sporting events, that kind of thing. Really the only experience I had that with that was during college. And soon after college, I always knew I wanted to work in professionals with professional athletes. And after college, during grad school, I found this company called Athletes Performance at the time. Now it's Exos. And I was like, well, that place seems cool. So I did an internship with them, and I just fell in love with the process of preparing athletes for their season and the integrative approach to like seamlessly integrating everything that they would need in the off season to get better. It was like my first experience of, more like practicing a little bit more like a physical therapist, in terms of a clinical, more of a rehabilitation or preventative strength and conditioning strategy. And I just totally fell in love with it. And so the joke with my fellow colleagues at Athletes Performance Exos was like, I did an internship and then I stuck around and hung out long enough so that they felt like they needed to start paying me because I was like just helping out with everything. And so yeah, I like created a role for myself there as an athletic trainer in the performance physical therapy department. And then I just sort of worked my way up and I was lucky to be one of the like original employees of Athletes Performance Exos. And so I was even though I was new in my career, I felt I was like a valued, and my opinion was valued, my knowledge was valued, and as everybody's was there, which was part of what made it so cool. And so was part of the original crew that created the methodology for the um performance and performance physical therapy there. And just I stayed at Exos for 11 years. and I became the director of performance physical therapy for all of the facilities across the country for them. And it was just a really amazing experience, and I am forever grateful for that experience because it made me a really great, well-rounded clinician, and then it also fed right into my love of learning anyways. There, one of the core things there was like to always be learning, to always be innovating, and I just found out that I was really good at assimilating information together when I learned it in courses, and um, so yeah, that's kind of where I started. Towards the end of my career there, my mom was diagnosed with lung cancer. And through that journey of her diagnosis and like reflecting on, um, I'm the type of person when there is like something like that goes on in my life, like the way I deal with it is to a little bit like from a control standpoint of try to control all the things like I can control, and then also lean into the knowledge piece of it, like learn everything I can about it. So when I was learning about lung cancer, diagnosing lung cancer, like symptoms and stuff, I realized that my mom had symptoms, musculoskeletal based symptoms, of lung cancer, like referred pain for probably about 10 to 15 years before that, like dating back to like when I was in high school. And I had a couple years prior, I'd learned from a colleague, my friend and mentor, Veronica Campbell. I'd learned about visceral manipulation through her, and she was like sharing like how big of a game changer it was. And I remember learning it and being like, meh, it's interesting, but I get good results. I don't really need it. But when I realized that my mom's um complaints of like shoulder pain and arthritis and like upper back pain, in combination with like failed physical therapy for it for years, decades, I realized, oh my gosh, like by not understanding what's going on the inside of our body, I'm like doing a huge disservice to my athletes and to anybody that I come into contact with. And I just felt really strongly that I didn't want, I thought about all of the healthcare providers that my mom saw that missed those signs and symptoms of visceral referred pain. And perhaps if they had that lens of view, they might have been able to catch the lung cancer earlier. And lung cancer is one of those cancers that usually it's not diagnosed until the late stages, which becomes like a death sentence. But if it was diagnosed in the early stages, it would be very curable. And so I was like, I gotta, I gotta look more into this. And then after she was diagnosed, and then watching her body shape and posture change in response to the cancer, like seeing how her whole entire bony frame organized itself around the viscera, um, as her lung collapsed, as the tumors got in different places in her body. It was also like, whoa. I keep telling people when they're doing shoulder exercises or exercises in general to like that their posture is something that they can like strengthen, and they can like it's because they're weak. And I'm like, this is not what people's posture is. Like posture is a response to what's going on the inside, both from a visceral standpoint and emotional standpoint. Like I was just like, my eyes were so open to that. And so I just decided, yeah, I'm going to start learning the visceral manipulation. And I took my first class from the Brawl Institute. Happened to be like a month or two after my mom passed away. And it was just so eye-opening and so amazing to learn the anatomy and like feel the changes in my own body. And so I was like hooked from the beginning. And, but I was just telling this to somebody the other day, the principles of osteopathic medicine, which is what the visceral manipulation like sort of comes from, are very different than principles of traditional orthopedic um, healthcare. And so I really felt like if I was truly going to assimilate the information I was learning from the visceral manipulation world into my practice, like I had to make sense of the principles and I had to make them work across the board. Like the principles couldn't just be followed when I was doing visceral manipulation work. They needed to like in order for it to make sense, there needed to be like a red thread or a truth that went both ways. And so I started exploring the osteopathic principles in a more orthopedic based way of like not forcing things, meeting the body where it is, um, working to facilitate like a safety, more parasympathetic response in the body. And I just started seeing like such amazing results that I was like, oh, like I'm really onto something. And so that's sort of once I left Exos and I started MovementREV, that was, the first. I'm at 10 years of having my own business, MovementREV, and probably for the first like 5 years was me sort of fishing that all out and like figuring out like who is Anna, the practitioner without Exos? Because my whole career up into the part was Exos. But then also like, what are my own thoughts about the body? What are my own thoughts? And like, it was the first time I had like permission to like make up my own unique thing. And so I spent the first 5 years sort of doing that. And then once I think I had it kind of figured out, I was like, okay, let's start teaching it to people and see if it works. So that's what I do now is I teach my methods to other practitioners like yourself. And then I still work with professional athletes. I travel with professional athletes throughout the year, keeping them healthy, taking care of them, doing post-op rehab if needed, but ideally more maintenance stuff. And that's it in
It's
a
amazing.
as abbreviated nutshell as I can do.
I think you did a good job.
Yeah, thanks. The highlight.
Um, I've learned so much from you, and I've loved a lot that I've learned from you. But like one of my biggest takeaways is meeting the body where it's at and trying not to force things and or like force things into the shape we think things should be.
Yes.
Can you kind of explain a little bit more like why forcing things doesn't work very well? Like
Yeah.
very simple terms.
Yeah. Yeah. Simple terms. I always tell people, like, if I push you, what do? Like, you push me back. Like, when I put force upon anything, forces return in an equal and opposite way, right? Like, that's just physics. And so, um, the other thing when it comes to our nervous system, when I'm forcing you in a way, we instantly go into a threat, defensive mode in our nervous system. And when we're in a threat and defensive mode, like our body's whole goal is to protect itself. And so if you think about from a manual therapy standpoint, or exercise standpoint, when we're doing those things to try to make change in the body, if you're doing it in a forceful way, you're eliciting that protective response and the body's not going to change. It might change for a moment because it sort of goes into like a defense mode of like shutting down and like submitting, but then 24 hours later, it comes back in an even more aggressive and defensive protection pattern. And so any changes that you made are just not kept. And so, I think, the beauty of working in the world of scoliosis like you do, both in your own body and with your patients and clients, is you get to see and experience in real time what it feels like to be forced into a box of what people think is normal. And when you do come across a practitioner like me who is like, there's nothing wrong with you, who am I to say that a certain posture is the right posture or is going to change how you feel in your body? It's just like, why don't we just honor that the body has so much more wisdom than we could ever imagine? Like, we will never fully understand the workings of the body because it is so intricately connected and it has such a higher level of intelligence than we can like cognitively experience or mimic. And my best example of that is like, we're born as a baby who is like needs support, right? Needs can't survive without its parents or, an adult taking care of it, or another human taking care of it. But at the same time, nobody teaches the baby how to develop into an adult that can walk and run and jump and talk and, articulate, right? Like, we don't really teach kids how to do that. develop in their own way, and it's usually oriented around our nervous system exploring our environment, and it just does it automatically. So nobody's telling the baby to like sit up straight. It starts to sit up straight because it starts to gain the strength, but it starts to gain the strength because it's trying to get to something it sees with its eyes, right? And so um that's the best example of, like, I think, the intelligence of our body. Like we can never figure that out, right? And then so leaning into that allows you to be like, who am I to say that I know how your body should be? And then also appreciating that however your body is like that for a reason, and it's probably like that to ultimately protect itself, because that is our bodies are wired for survival. So everything that it does is to ensure our survival. And so when you can like see it from that, you have this compassion that, like, I don't need to force it anymore. And so, you know, with the people that I have worked with that have scoliosis, like, just sometimes giving you a few pads, you know, a few towel rolls to lay on and support your curves and meet your body where it's at, instead of forcing it into a box of our, you know, our society's world of like right angles, right? Like, I know, acknowledging that you don't live in a right angle, you live on a curve. And so just meeting you where you live, all of a
Mhm.
sudden you get this very visceral, very big shift of your nervous system from a protection mode that it is in all the time, because society is forcing you to be a certain way. Like, our furniture and stuff is not designed for someone with curves. And you finally get to shift into that safe rest and relaxation mode of our nervous system. And it is like a very visceral, audible, visual change in your body. And I I'm big on having people recognize like how that feels, because when you can feel that way in your body, which is usually described as like free, there's width, there's space, there's lightness. Those are also words that we tend to associate with when we know we're like standing in our truth or standing in truth. And so I'm like, if meeting your body in its curves feels like the truth, then that, like, it is, because it is, because there was nothing wrong with you in the first place. And the thing that felt bad was that we were believing something that wasn't true. The thing that we were not believing that was true is that we are perfectly fine the way we are. And so yeah, it's a very I love it. I always love having someone in my courses that has scoliosis, because it is like such a huge teaching moment of that principle of meeting the body where it's at and not forcing things. And you get to see how quickly it changes and how quickly pain goes away, you know, because we're more sensitive to pain when we're in that defensive protective mode. And so sometimes just shifting people into the more rest and relaxation state totally takes their pain away. Like, it
Yeah.
can be that simple.
Yeah. Which is totally crazy because, you know, with scoliosis specific exercise, it feels very complicated. I mean, it's
Yes.
pretty complicated. Um, and a lot of it is forcing the body into a shape that it doesn't want to be in.
Yeah.
You know, with that said, you know, learning from you and learning those principles, I have a lot of cognitive dissonance going on, just
Yes.
trying to reorient my mindset and my way of thinking about my own body, my clients' bodies, the way that I've been doing things, and trying to meld the two things, because I do think that there's a lot of value
Yeah.
in some of those principles. And one of the things that was crazy for me, you know, the nature of scoliosis is, you know, you have the asymmetrical loading of the spine that causes the vertebrae to be wedged in a different
Mhm.
shape. Um, and the mindset is to bring things into more of like a even loaded position to alleviate, you know, those symptoms that you're getting from
Right.
nerve compression, visceral compression, all those things. So when I was taking the spine portion of your mentorship, and you were talking about articulation and distributing the force all throughout the spine. I just felt like there was a light bulb moment for me where it made so much sense in that, like, we have all of these maps in our brain of different areas of our body. And if we're just always constantly in that neutral spine position and not exploring movement through all the segments of the spine, those maps are blurry.
Yeah.
So the brain is going to see that as a threat.
Mhm.
And like, I literally was just like crying because it made so much sense. And I
Yeah.
just feel like that's how I feel in my body. I feel best when I'm able to move through all the different ranges of motion and not keep myself in the static box.
Right. I mean, that's amazing. And it is, and you can even apply that in, patients that don't have scoliosis that are taught that their spine is supposed to like be in neutral all the time to be healthy. And it's like, if it was supposed to be like that, it wouldn't be 25 to 32 movable parts. It would be one long bone like our femur. Like, like I'm like, that's just, structure and function are intimately like connected. And so to like not believe that using all the ranges of motion available on the spine is beneficial to our health is just like a little crazy. And then too, from a scoliosis standpoint, it is funny because it's like, and using this term neutral, it's like, well, your neutral is with a curve right now in this moment. It doesn't mean in 10 years of you doing exercises, your neutral will be in the same spot. None of ours are. Our bones are, this is the other thing too, like people think bones are like so fixed, but they turn themselves over every 7 years. And so it's like we have a whole new skeleton every 7 years. And like if that doesn't give someone with scoliosis some hope, I don't know really what does, you know?
Right.
And the thought process too, even from the Brawl Institute, from the more osteopathic world, is part of the reason why scoliosis forms in the first place is maybe um, the bones are orienting themselves around the viscera, that and the viscera have some sort of like adhesions or tensions in them that can come from birth, can come embryologically, right? That are pulling on the bones, and the bones are just getting shaped around them. And so it's like, you know, if we can like take a step back even and start to do some more like visceral based manual therapy or visceral based even movement, like moving from the lens of more inside the body movement, like the how that feels on your skeletal system is a totally different experience. And so, just like you said with the map of our body, in our sensory motor cortex, we have a map of our body in our cerebellum. And then we also have a map of our organs in our insular cortex. And so it's like just being able to speak to your organs differently can change the brain's experience of where we are in space, and therefore, change the musculoskeletal structure around them, the dynamic alignment. And so, um, with articulation too, because every time, I have this conversation with somebody and it's like, well, what would it look like then, like a spinal roll down for someone with scoliosis? I'm like, well, it would look like them being aware of where their curves are and what that means, where their neutral is today, and like allowing it. So it's like if I have a right rotation in my thorax, then it's like I start, my spinal roll, quote unquote, like the world's neutral, at my cervical spine. But then when I get to my thoracic spine, I go ahead and like let myself rotate. And this is where like paying attention to how you feel is important, because you'll know where your neutral is because it will feel easy to move through. Because when our bones are when our vertebrae is in our neutral zone, we have the most degree of freedom for movement because we're not taking up slack in a different range of motion. And sometimes what really binds people and makes it not feel good is when you're trying to stay neutral in your spinal roll down when you have scoliosis, because since you're rotated to the right, you're already taking up slack in one plane. So you're limiting your motion in the other one. So it's like, what if I just met myself in the plane of motion that I'm in? Then all of a sudden I have all these degrees of movement again, right? And by waking up those proprioceptors in the joint, like you talked about, like cleaning up that blurry map. Now, when I go even maybe into my second rep, my neutral is not 30 degrees of right rotation, but it's like 20 degrees. And so it's like your neutral is changing as you get better information. That's happening in everybody's body, not just scoliosis, right? Like, and so it's like, this is one of my big things, like one of my big goals in the world is like giving the patient, giving people back the trust in their body and the autonomy to follow that, to believe how your body feels more than you ever believe me or another clinician, because we're just making fucking shit up. We're not in your body. I can't tell how it feels.
Mhm.
And so this is a conversation I have with my athletes all the time. I'm like, don't believe me. I
Mhm.
get it. You trust me fully. And I love that, you know, and I know that that comes for me, that gives me great power over them, that they trust me so much because I can say anything and they believe it, which is then more important, even more important to me to be like, don't believe me because I said so. This is not a I'm your parent, it's because I said so sort of thing. This is a how does it feel to you? Do you like how this feels? Does it feel those qualities of truth or those qualities of like a a safe movement pattern, which is like light, lifted, spacious? Does it feel like that when you do a roll down? Then yeah, we're probably in your neutral.
Yeah. Yeah.
So, um, and this is why, like, yes, I know you have cognitive dissonance, like trying to blend the two, right? Like learning the more, you know, lack of, no pun intended, the more rigid approach to scoliosis, and then this more flexible approach to scoliosis. And the beauty is that you can blend them together because that rigid approach works for a lot of people and they do get a lot of relief. I think sometimes what gives them a lot of relief is they start to just
Move.
feel better in their body
Yeah.
because they're moving their body, because movement, right?
Mhm.
And it is trying to create space, which I can appreciate.
Yeah.
Um, but it's so also like it can be even easier to do. And hopefully that's what you found is when you're adding in these principles to what you know works, it's like you're helping people get there in a way that doesn't feel so forceful.
Yeah.
Like they kind of find it on their own and then they're like, "Oh, great. These are the principles we're trying to do with this method of scoliosis, but now we can get you there without you like fighting it so much." It's
Right.
more of a awareness from the movement experience and seeing how your body changes with different sensory information versus a cognitive like lengthen here, shift here, breathe here, like do this. Like no one should have to
Yeah.
organize themselves that much cognitively around their body because it's not going to carry over to life.
Mhm.
We would be such slow movers if every time we went to move, we had to like think about like lengthen into this side and rotate here and do this and this, like that's just silly to think that that is has like easy carryover to dynamic life.
Mhm.
It
Yeah.
does have some carryover, right? Because we do go through a process of it becoming cognitive, you know, to a little bit more normal. But man, that takes a long time if you only start at the cognitive side. If you can just bring in the sensory experience, you go whoop, really
Yeah.
fast. Hmm.
Yeah. It had been a little bit of time since I moved, like more in a free way.
Yeah.
And I think day one at your course in California, I was just feeling stiff and uncomfortable. And then day two, we did that movement experience in the
Mm.
beginning of class. And afterwards, I'm sitting there unsupported and like I felt so light. Like I didn't feel like the fatigue that I normally feel in my low
Yeah.
back. Like when I'm always, trying to
Yeah.
elongate, be in my neutral position, it is fatiguing because
Yeah.
uh, everything's having to work overdrive.
Hmm.
Yeah.
Yeah, that's cool that you saw that because, you know, as I was teaching that course too, like I was observing how everybody's moving and like how bodies are changing. And obviously, like I saw big changes in your body when we were doing the check-in of the forward fold, and it was just really cool to see with each little exercise that we did when you went to check back in, it was like a more um a movement experience that I could visually see the tension melting away from,
Mhm.
and your curve
Yeah.
sort of I don't want to say normalizing because I don't like that word because there's not anything not normal
Yeah.
about you, but your curve lengthening out and like finding its space and ease on its own.
Mhm.
Like it was a very visual thing, and it was interesting to see what exercises on you like changed it more than others. And,
Mhm.
and then what I saw and what you felt didn't necessarily match up, but it was like a cool thing to discuss anyways.
Yeah.
So,
Yeah. What do you, I mean, you kind of already talked about it, but what do you notice the most, like with people who you've worked with who have scoliosis? Like, what has been like maybe like a trend that you've seen with them?
well, first of all, I don't have a ton of
Yeah.
patients, athletes with scoliosis. So I'm not speaking from a big like subject group at all. But from the few people that I have, well, and I think this is like almost like the value of me not working with that as like a specific population because I don't treat them any differently than I would someone else, right? Like I am like, okay, like let's see what your body has to tell me. Like who am I to know what your curve or should not be? And like let's just do the same, the locator test assessment protocol or the general listening on you and see where your body directs me and then treat there and then be curious what changes. And just like I would for someone that doesn't have scoliosis, I am curious to what is their posture, what is their shape when they walk in, and then what is their shape when we're finished. Because when they walk in, most of the time they're in a protective pattern. And then when we finish, they're out of that protection pattern. And so it is a better indication to me on what needs to be focused on, like what is a true structural thing that matters when they leave me versus when they come to me. And so
Mhm.
that's number one. I think the most profound thing of working with someone with scoliosis is like not treating them any different than anybody else, to be honest.
Yeah.
And then the other thing, though, the only difference, I guess, would be whenever I do lay them down or sit them on a piece of furniture that is made for someone without scoliosis, like all the furniture in the world, that I meet them where they're at because it would be like me laying on a crooked table. It wouldn't be very comfortable and I wouldn't get a true sense of your joint mobility because I'm not testing it in your neutral. And so using pads to put under you and as much as I try to like make it make sense and be like, well, where's your curve? Let's do okay, that means that I need a pad here. I'm like, I don't, at the end of the day, that's like a really hard long division math problem. I'm
Right.
also like, or we could have a stack of hand towels and like just start shoving them in spots and like see if it makes you feel better. And then
Yeah.
once we have that spot where I notice your face soften, your breath change, it's almost like it looks like someone's taken a big deep breath, like a sigh, like a finally, like it's that moment when you're like, oh, I can finally relax at the end of the day. When I see that in someone's body on the table, that means that I've propped their curves enough that I've met the body where it's at. And I see that shift into their nervous system. And I will say that solely teaching people with scoliosis that is sometimes the most profound thing I give them. And that helps them with, 80% of the things that they were complaining about, if not more, because also it makes you realize there's nothing wrong with you. And when you can let go of that idea that there's something wrong with you and that you're supposed to be in a certain way, because adding those towels in allows you to see that there's nothing wrong with you, there's something wrong with the table. And just giving you that permission is like changes a lot.
Yeah.
Like the stories we hold on to when it comes to our body and movements like affect us way deeper than we can really appreciate until you feel it in real time. And so I'd say that's probably like the number one thing that I basically, like, it's not even a real physical thing. It's more of like, hey, permission to be in your curves. And if there's anyone that you work with that doesn't allow you to be in the curves, don't listen to them. Like, permission to not. per- and again, I tell this to my athletes too that don't have scoliosis. Like, if doing a squat in the weight room feels best when you let your feet turn out a little bit and your knees cave in, and you feel good and you feel powerful in that position, then every time a coach tells you to turn your feet in and push your knees out, just ignore them.
Yeah.
And most of the time, if you ignore them or just be like, okay, yeah, thanks, coach. And then you just keep on doing what you're doing, they don't notice. And if they do notice, and then they say something to you of like, oh, you don't understand what I'm saying, you need to do this, then it's like, no, this is an opportunity to have a conversation with them about, hey, that doesn't feel good in my body. And I honor your knowledge, but my body, my choice, and I'm gonna follow its wisdom.
Mhm.
And then that's a moment where you get to see how the coach or the practitioner responds. And if you don't like their response, that's kind of like, it's like dating someone. It's kind of like a red flag. How many red flags are you going to settle for before you realize that maybe that person is not for you?
Mhm. Yeah, that's huge.
Yeah. So, I mean, yeah, most of my people with scoliosis, I'm like, well, what do you want to do in the weight room? And they're like, oh man, I would love to like barbell squat. I'm like, okay, well, go ahead and let that barbell twist.
Mhm.
Let the barbell follow your body.
Yeah.
Don't meet the barbell where it is. The barbell is very boring. Let the barbell come to your party and then like move from there. So,
Yeah. Yeah.
yeah. And I
And
think too, because there's this thought process, and maybe I'm wrong, but I kind of feel like sometimes there's this thought process of because you think something's wrong with you when you have scoliosis, when you're in a gym setting, you don't want to bring attention to yourself.
Mhm.
Right? Because you already think there's too much attention on you and your body being wrong. And so sometimes when I'm like, let the barbell turn, people are like, oh my God, but what will everybody say? And I'm like,
Who cares?
who cares? Who cares? Who cares? Eyes on your own paper. Who cares?
Yeah. Along the same lines, it's, you know, with scoliosis specific exercise, like going into repeated end range, flexion, extension, rotation, side bending is kind of frowned upon.
Yeah.
Uh, and I think what that ends up doing when we speak that over our patients and over our clients, they become frozen and are afraid to move at all.
Yeah.
And I think that's just like a whole nother layer of all of this, and that like we want people to be able to move freely and move more. And when we put all these rules and restrictions around them, of course they're going to be afraid to move and
Yeah.
not know. You know?
Yeah.
So yeah.
Because I'm sure, because all those rules come with like, if you do this too much, you're going to wear out your discs or you're going to damage this or damage that. And then you're going to be fucked. And sorry,
Yeah.
excuse my F bomb. I don't know if you do explicit, explicit podcasts, but now you do. But yeah, like this is why I'm like, it's not, this is, man, if there's one thing I could get practitioners to understand, it's not our job to give people a story about their body.
Mm.
And
Yeah.
when I'm very careful at when I am giving people a story about their body, I say it like that. You know, I was just seeing a patient the other day and he had, he has back pain and somebody told him that his glutes were shut off and I said, "Hey, I don't like to talk crap about other practitioners." I was like, "But let me tell you something. Your glutes are just fine. You're standing. Your glutes are perfectly active. Like, I promise you, if your glutes weren't active, you would not be able to stand up." I
Right.
was like, so let's just understand that there's actually nothing wrong with you in that sense. I was like, there's nothing wrong with you, period. I was like, but, you know, I was like, if you want a story on how maybe I think your back pain is coming, like here's what I think. I said, but at the end of the day, it's still a story I'm making up about your body. It's a story I'm making up about your body based on the way the anatomy is connected. I was like, but also that is a biased story too, because the anatomy always was and will always be connected because we started as one cell. I was like,
Mhm.
so I have multiple ways that I could connect this and make a story about it. I was like, but that's all it is a story. It may be true, it may not be true. I was like, I'm happy to give you one, but it's very important for you to know that it is a story. There is literally no way for me to know why your back is hurting.
Mhm.
No way.
Yeah.
I was like, you can have 5 extruded discs, and me telling you you have pain because of that is still a made up story. There's no way for me to know that. I was like, that's too because of the complexity of how pain works. Pain is an output from our brain, not an input. So it's like, who are we to say like these extruded discs are why you have pain?
Yeah. Right.
Made up, totally made up.
Yeah.
Could there be some truth to some of that? Sure. But also, like, could it be completely untrue? Yeah. And so
Mhm.
I'm like, when I think too, when you can give those disclaimers to the patient, then it's like
Yeah.
very powerful. And he even said, he's like, like, basically when he was leaving, he said something about like, I was just like wrapping up what we discussed. And I was like, hopefully you can see that there's like a lot of things that we could start focusing on to see if we can change your pain experience. I was like, but also you've had back pain for like 20 plus years. I'm not going to get rid of it in one session.
Yeah.
I may, if you're having back pain today, I might get rid of it in one session. I was like, but the chances of your back pain coming back are really high. I was like,
Yeah.
but also I was like, I want you to understand that because there's so many factors about it, um, it may come back, but I want you to have the tools that you know how to deal with it now. And he's like, yeah, because he goes, I get pretty frustrated sometimes because I'm like, oh, what did I do wrong? And I
Yeah.
said, see, that's the thing. I was like, you did nothing wrong. I was like, sometimes your back will hurt and there'll be no rhyme or reason to it that you can control. It's not something you did or didn't do. It's just simply where you're at. And you have to trust that your body's trying to tell you a message and take it as like, view it with some compassion and being like, let's think about the things that could be creating an environment while I'm having some pain. I was like, but the thing is when you've had pain in one spot for that many years, I was like, whenever your cup gets too full and you have an increased pain response, that's kind of going to be the area that you hurt. I
Yeah.
was like,
Yeah.
so, but it doesn't mean that it's your fault because you didn't work out 2 times this week, or, it's your fault because you're overstressed at work. Like, I was like, stop taking it so personally and just like, there's nothing wrong. Like, and that was a big lesson that I had in my own body too, especially when I learned the visceral part of it is like, man, knowing that it wasn't an exercise or I did or didn't do that caused my back pain, that it probably had more to do with like the food I was eating.
Yeah. That's a big
Right.
eye opener. Yeah.
Right. And then too, like, not again, because it's not even sometimes the food, it's the state of my nervous system when I'm eating that food. Then it's like, it takes the pressure off about feeling bad about yourself. Like, there's like, it is what it is. It's just back pain. Like, let's just meet our body where it's at and like try to make it feel better and like take the message from the universe that I need to slow down. Like something like I'm just, like,
Yeah.
so it's an interesting, it's always interesting how these conversations with patients go because it's like they want a story, but they
Yes.
also don't want to feel like, and they want to feel in control, but they're going at it the wrong way. They're trying to be in control by blaming something that there's something wrong with their body when there's actually nothing wrong with their body. Right. And so I think sometimes having control is actually realizing that the only way you have control is recognizing that your body is doing it for a reason. And like, here are all the ways I can support it
Yeah.
versus here's all the ways that I can manipulate my body into being a certain way. Right.
Mhm.
And I mean, obviously, it's like I hear these words coming out of my mouth, and I'm like, this is like literally true in the fitness industry, like body, body image, like personality, relationships. Like, this is all like it all is the same.
Yeah. Yeah. Across the board.
Hmm. So,
Yeah. I feel like I could talk to you forever. But I think that we do need to wrap up. I usually finish these interviews by asking, what are you doing to stay ahead of the curve? So like, is there a book you're reading right now that you think that could be useful for people, or you're really just enjoying right now, or
Hmm.
type of food that you've eaten recently that somebody might not know about? I know I'm putting you on the spot.
What do I do to stay ahead of the curve? I mean, maybe this is for this is kind of for everybody, but like realizing that sometimes you have goals and like things that you're wanting to get done, or be productive about, and then stuff happens in life and you have to like on the spot, like be okay with being flexible in terms of it not being the right time, right? So and then also realizing like it's okay to change your goal in a second and then like have totally different priorities. And so that's what kind of like this year is for me in terms of like I had all these like big business goals this year and they're still business goals, but one of my athletes had a major injury and had to have surgery. And so now we're like post-op rehab and he's got big goals. And like, when I sat down with my business coach at the beginning of the year, I realized like my number one goal is getting him his goal. And the only way I could do that was take my business goals and like, I don't want to say put them on the back burner, but drop them down on the priority list and be okay with that. Like, and be like, there's nothing wrong with that getting these pushed off, because if I really sit with it, like I have a new priority. And so I think, probably I see this with my colleagues and stuff that have kids sometimes, or like, they had all these goals and then they had a child and then like now the things are
Yeah.
changed. And I'm like, there's nothing like it. Is there a moment that you kind of have to grieve the change? Absolutely. But also like there's nothing wrong with that. And like we have so much time to do all the things. So it's kind of silly to stress ourselves trying to do all of them all at once when we can easily just like slide things over to the next quarter or the next year. So nothing I'm reading, but definitely like where I'm at this year
Yeah.
is like being okay with redirecting and still
Yeah.
prioritizing what I think should be prioritizing, but being okay that it wasn't the thing I thought I was going to prioritize this year.
Yeah.
So,
Thank you. Um, Thanks for coming on. If
yeah,
people follow you or learn more about you, take a course from you, what are some
yeah.
ways that they can do that?
Yeah, so I'm at MovementREV on all social medias. I'm most active on Instagram, YouTube. My podcast is on YouTube. My podcast is called Unreal Results for physical therapists and athletic trainers, or vice versa. I don't remember what it comes down to, but that's on all the podcast players. So that's always a great way to learn from me. I do have a free course coming up April 14th, I think, the results cheat code. So that is my free 1 week mini course leading up into my like signature course, which is the LTAP level 1. LTAP stands for the locator test assessment protocol. So, yeah, I'm excited about that and hoping to teach some new people and do all the things.
Well, thanks for coming on. It was awesome having
You're
you,
welcome.
and uh, look forward to keeping in touch and seeing all the awesome things that you're doing. So
Yeah, well, thank you. Thanks for having me. It was a pleasure.
until next time, stay well and stay ahead of the curve.